Hello, everyone. My name is Haley. Today, I will be highlighting key points on the healthcare in the Netherlands. There are many wonderful aspects about this country, such as the tulips, tasty chocolates, unique culture, and many more. With such great things, healthcare happens to be one of them, according to Euro Health Consumer Index. There's never a place that's perfect, so today I will go over two ethical problems, that is, wait times and racism, a common issue faced globally. First, let's look at the background of the Netherlands. Before we get into that, here are the main topics that I will be going over today. So, 1, the structure and foundation, 2, government policies, 3, different insurances, 4, health rates, 5, environment and social factors, 6, ethical factors, and 7, overall rating. As shown on the graph below, it represents the different races and ethnicities in the Netherlands. On average, the Dutch population contains about 18.22 million people, whereas the US has 333 million. That is a big difference. On average, the life expectancy is 82 in Holland, whereas the US is 79-year-old. Now I will be breaking down the Dutch health system and how it works. So it is structured by the universal health system, and it can be broken down like this. The 0th line, which is automatic, this is when you go to preventative care, such as getting your flu vaccines or getting certain exams done, such as your yearly exam. Or the first line is more sick patients that go to their primary doctor. An appointment is needed, but no referral. The second line is a healthcare provider that is provided by a health specialist. The third line is structured as long-term exceptional care, such as rehab after a stroke. Eligible. The government in Holland is quite unique than others. So, as soon as a person lands to the Netherlands, regarding work-related purposes or residency, they must apply for healthcare. And this is mandatory for certain reasons. To register, you must obtain a BSN number by the government. Some reasons why this is mandatory is for liability purposes and ensures you have coverage and or medication if needed. This is great for people who don't have much factors that can help them with their health care. This is a big difference compared to here in the US, as it's not really mandatory here. You won't really get a knock at your door for not having health insurance. It is recommended, but if we were to go to the hospital and have certain kind of treatments, we would get a bill right then and there. But it's not mandatory to have health insurance here. In Holland, they will get a knock on their door and be warned that they must get health insurance or else they can no longer be in the country, there will be warning of bills and fees that may need to be paid. So now that you are registered and everything is processed, you now have access to the GP or the general practitioner or the primary care physician. They refer you to specialists or other care if or when needed, depending on your insurance plans. Insurance is separated into 3 compartments and has 2 policies. The 3 compartments are long-term care, basic health insurance, and supplementary care. You are able to get supplied with medication from the pharmacy and receive hospital care if needed. Supplementary packages include physiotherapy, dental vision, travel medical, alternative care such as MRI, physical therapy, X-ray, and extra services. The government determines what is involved in your healthcare plan and supplements by private healthcare insurance company. As previously mentioned, there's no place where there's perfectionism. Now that we have covered the basics, I will show 2 examples of how some ethical problems may arise in the Netherlands, more so of healthcare. These 2 topics will be racism and wait times. Just like any country, these problems can arise, but it's unique how the Dutch handles these situations. Problems related to the following affects the overall treatment and well-being of the patient. If the physician prioritizes others based on being in the same race group or agreeing with one's moral beliefs than the others, if more time is spent with one patient than the other, this is what causes unequal treatment. Because although the concept of everyone receiving healthcare is wonderful, they can experience things such as the patient not having enough time to review their medical history, to gather the right information, to give the right medical diagnosis. The topic of racism can be shown by the story pulled from a YouTube video in 2022. Ravana, a college graduate, was sat down by a journalist who asked her questions of her experience with racism in the Netherlands. She was driven to write this thesis statement when experiencing racism her own self by a professional. She believed her poor mental health was caused by the disadvantages from her color she was experiencing, but the health professional was not looking at her side. She was asked by the journalist, "Is there racism in the Netherlands?" And she answers yes. She outlines key factors that help indigenous people to determine key characteristics when seeking professional help. This allows people to connect with Ravana and not feel alone when it comes to seeking for professional help in their health care. She goes on to mention giving people advice such as watching out for body language or gestures by the provider or tones in their voice that can give out racism. Taking a look at Ravana's perspective can help others see what people of color in the Dutch face. Highlighting the ethical problems of other countries helps understand the similar hardships that are faced that we experience in the US and what is done to go about them. Thanks for watching.